Question number 38. Which of the following MR sequences is more sensitive in detecting subcortical and periventricular lesions in multiple sclerosis? Axial. Okay. Which of the following MR sequences is more sensitive for detecting subcortical and periventricular lesions in multiple sclerosis? Axial. This is cyclical, but axial is most sensitive for detecting subcortical and periventricular lesions in multiple sclerosis. Question 39. CT scan of the brain demonstrates irregular, ill-defined mass in the left frontal lobe extending across the corpus callosum to involve the right frontal lobe. The mass is of low attenuation and contains cystic areas. Demonstrates ring enhancement for intravenous contrast and has considerable surrounding edema, most likely diagnosed with glioblastoma multiforme. CT of the brain demonstrates irregular, ill-defined mass of the left frontal lobe extending. Okay. Glioblastoma multiforme. CT scan of the brain demonstrates irregular, ill-defined mass of the left frontal lobe extending across the corpus callosum to the right frontal lobe. Mass is of low attenuation and contains cystic areas. Demonstrates ring enhancement following intravenous contrast and has considerable surrounding edema, most likely diagnosed with glioblastoma multiforme. Irregular, ill-defined mass in the left frontal lobe extending across the corpus callosum to involve the right frontal lobe. Mass contains cystic areas, ill-defined, and demonstrates ring enhancement following intravenous contrast and has considerable surrounding edema, most likely diagnosed with glioblastoma multiforme. Then 40. Low rotary action. Within minutes, she experiences an occipital headache and neck pain. CT scan of the brain with abnormal findings is most likely. Expansion of the vertebral artery with a peripheral high density crest. Okay, this is low velocity rotary action. Within minutes, she experiences occipital headache and neck pain. CT scan of the brain with abnormal findings is most likely. Expansion of a vertebral artery with peripheral high density cleft. So when the patient has low velocity rotary action, within minutes, she experiences occipital headache and neck pain. CT scan of the brain with abnormal findings most likely. Expansion of the vertebral body artery with a peripheral high density crest because it involves the occipital lobe of the occipital headache. So posteriorly is a vertebral artery. 41. Where man or vertebral artery dissection. Man has severe rhinorrhea and then develops a graft with hemoptysis. C. Thorax was cavitating left lung nodule. Or cerebral scatterangiogram is most likely to be which of the following: multiple aneurysm, stenosis, and occlusion. Man has severe rhinorrhea and then develops a cuff with hemoptysis. C. Thorax was cavitating left lung nodule. Cerebral scatterangiogram most likely to be which of the following: multiple aneurysms with stenosis and occlusion. This is rhinorrhea and then cuffs. This is regular granulomatosis. Regular granulomatosis there in scatterangiogram there is multiple aneurysms with stenosis and occlusion on regular granulomatosis. Question number 42. CT for pattern of generalized global brain atrophy shows marked temporal lobe predominance and increase in size of the hippocampal choroidal fissure is seen. Quantity 2 where images shows atrophy of the hippocampus bilateral, which contains most likely Alzheimer's disease. CT for pattern of generalized global brain atrophy shows marked temporal lobe predominance with an increase in the size of the hippocampal choroidal fissure is seen. Quantity 2 images shows atrophy of the hippocampus bilaterally, which contains most likely Alzheimer's disease. See, atrophy of the hippocampus bilaterally is seen Alzheimer's disease. Atrophy of the hippocampus bilaterally is seen Alzheimer's disease. You can see on coronal section more better. But atrophy of the hippocampus bilaterally is seen Alzheimer's disease. For the patient with multiple previous ischemic strokes, MRI shows the left frontal lobe there is region of increased fetal signal, the same area dark on DWI and bright on ADC map, most likely area of this region of ischemia 4 months. Patient with multiple previous ischemic strokes, MRI the left frontal lobe there is region of increased fetal signal, the same area dark on DWI and bright on ADC map, most likely area of the region of this ischemia 4 months. I bleed, I die, bleed, die, bleed, die, die. So they're mnemonic. So dark on DWI and bright. So and bright on ADC. Most likely age is 4 months. Question number 44. Man with a mass in the right side of neck, anterior surgical side, and below the highlight bone, above cricoid ring. Which level is the node? Level 3. Man mass in the neck. It is anterior sclerodermal side, below the highlight bone, and above cricoid ring, below the highlight bone, above cricoid ring. as seen at level 3. 45. Which of the following period would suggest the presence of bilateral spondylolysis as a cause of reduced height of L5S1 disc, widening of the AP diameter of spinal canal at L5S1? Which of the following period would suggest the presence of bilateral spondylolysis as a cause of reduced height of L5S1 disc, widening of the AP diameter of spinal canal at L5S1? If you said the presence of bilateral spondylolysis as a cause of reduced height of L5S1 disc, widening of the AP diameter of spinal canal at L5S1. For which is bias found to have paralysis of upward gaze, Bernard syndrome on examination, what is most likely site of the lesion? Pineal gland. Bias found to have paralysis gaze of upward gaze, Bernard syndrome on examination, most likely site of the lesion? Pineal gland. Paralysis of upward gaze, Bernard syndrome on examination, most likely cause site of lesion? Pineal gland. 47. Woman with headaches and when Pineal syndrome comes, then likely site of lesion? Pineal gland. For example, woman with headaches and refractory temporal lobe epilepsy. These are the brain shows mixed forehead cystic interperitoneal mass located peripherally in the right temporal lobe, which contains calcification and demonstrates brain enhancement following internal contrast. There is minimal surrounding edema, most likely diagnosed ganglioglioma. Woman with headaches and refractory temporal lobe epilepsy. These are the brain shows mixed solid cystic interperitoneal mass located peripherally in the right temporal lobe, which contains calcification and demonstrates brain enhancement following internal contrast. Minimal surrounding edema, most likely diagnosed ganglioglioma. Okay. There's woman with headaches and refractory temporal lobe epilepsy. Then there's mixed solid cystic interparenchymal mass located in the right temporal lobe, contains calcification and brain enhancement. Diagnosis: ganglioglioma. 48. Appropriate window width of and level for viewing the bony structure on CT scan of the brain: width 2000, level 500. Appropriate window width and level for viewing the bony structure on CT scan of the brain: width 2000 and level 500. 49. Bruising over the right temporal region. This scan shows longitudinal fracture through the precious temporal bone, but complication should be considered conductive hearing loss. So this is longitudinal fracture to the precious temporal bone. What should be complication should be considered conductive hearing loss. Longitudinal fracture to the precious temporal bone. What should be considered conductive hearing loss. 50. CT scan of the brain shows oval, well-defined heterogeneous hypotenuse mass containing all well-defined heterogeneous hypotenuse mass containing large nodule clumps of calcification located near the periphery and the right frontal lobe. The mass extends to the cortical margin and there is erosion of the inferior table of the skull. There is minimal surrounding vesicular edema, most likely diagnosed oligodendroglioma. Well-defined heterogeneous hypotenuse mass containing large nodule clumps of calcification located periphery and the right frontal lobe. It extends to the cortical margin and there is erosion of the inferior table of the skull. Minimal surrounding vesicular edema, most likely diagnosed oligodendroglioma. For example, which period on parathyroid sonography using perturbation system EB with delay washed out images was suggest a functioning parathyroid adenoma at this site? No uptake on perturbation, increased uptake on system EB with delayed wash out. Now, functioning parathyroid adenoma periods are on no uptake on perturbation, increased uptake on system EB and with delayed wash out. Parathyroid adenoma, functioning parathyroid adenoma have no uptake on perturbation, increased uptake on system EB with delayed wash out. 52. Cerebral angiograms with bilateral occlusion of the distal internal carotid arteries extended near proximal anterior and cerebral arteries. These are associated with an extensive network of upper brainstem collateral, which is most likely cause Moyamoya syndrome. So cerebral angiograms with bilateral occlusion of the distal internal carotid arteries, and associated with an extensive network of upper brainstem collaterals, extensive network of upper brainstem collaterals, seen in Moyamoya syndrome. Extensive network of upper brainstem collaterals. Diagnosis: Moyamoya syndrome. Cerebral angiogram, bilateral occlusion of the distal internal carotid arteries extending to the proximal anterior and middle cerebral arteries, associated with extensive upper brainstem collaterals. Diagnosis: Moyamoya syndrome. 53. Female with congenital clap headache and fluctuating level of consciousness. CT scan shows high density material layered in the occipital horn of the lateral ventricle. Most appropriate next investigation: CT angiography. Female with congenital clap headache and fluctuating level of consciousness. CT scan shows high density material layered in the occipital horn of the lateral ventricle. The most appropriate next imaging investigation: CT angiography. because she has subarachnoid hemorrhage, somewhat abdominal investigation, CT angiography. 54. Patient involved in an accident in which femur is fractured. Several hours after the injury, pediatric skin hemorrhages appear associated with respiratory distress and hypoxia. The following brain MRI findings best account for the patient condition. Multiple small non-confluent hyperintense localizations on T2 WMS and WI within the cerebral deep white matter and deep gray matter. Patient involved in an accident in which one femur is fractured. Several hours after the injury, pediatric skin hemorrhage is seen. Associated with respiratory distress and hypoxia, which will find MRI imaging findings best account for the patient condition. Multiple small non-confluent hyperintense lesions on T2W images and T2